We are asking you, what do you do? Why do you work here?
Serus tu dem be Tianggola mah service naik Clear lo sana. Dan tam sama Tianggola kar service ne, depois Tianggola service saya deh.
Au service naik Clear, ya 2003 ne tempo 2003 au service ne. Tambah tempo ne hau moras maka doktor bolu hau service ne.
He started to work here when he was sick, and then Dr. Daniel called him and then told him to come here and working here.
Hau mai fali, haruko hau mai dengan kata service ni kan, lah, mana, service para, tempo ni kan, doktor bolu hau moras era, hau mai bolu mai, hau service azure klinik, ia tinan malon, dia mana tinan malon.
He's been working here for almost 8 years already. Yeah.
Okay, so here we are at Bairo Pite, and this is Manafi, who's the office administrator, HR clinic manager, payroll supervisor, and now she's dealing with the dogs. What's the story on the dogs?
On the dogs today, we've got a friend of Bairo Pite Clinic, Mr. Shane. He's got a boat out in the bay, and he spends his time collecting from, like Robin Hood, right, collecting from rich countries and bringing necessary items to developing countries. And he has some goods for us.
Right.
They're ready to pick up. They've got the necessary permits from customs and so on. But vehicles to go and collect it is a problem, because we've got one ambulance off the road right now, and we need another ambulance to go to the mobile clinic in the districts. We've got a little car, but it's not big enough.
Remember the AML, the leukemia one? Yeah. The one supposed to be go to Singapore, but the Singapore doesn't accept. So maybe the Indonesia.
She has acute myeloid leukemia. So this is her, and she comes from the mountains, Ailiu. She sings in the church. She is always drawing things. She can't sit still. She's busy doing all kinds of creative things. And we're hoping that within the next couple of days we can get her into a hospital in Jakarta, maybe like one of the best ones there. One wealthy man said he'll help.
We're going to university, and I just get some certificate like.
Oh, this is Fatima here. Fatima Mendonça, yeah? Senior first aid.
Yeah.
This is what you're talking about.
If the other doctors come, they teach me how to do the sterile, and when you do the small operation, everything have to sterile. Yeah, this one is very important for the patient, so the patient can get better.
I'm a physician from Boston, Massachusetts, in the U.S. I volunteer here in the mornings at Bairo Pite. I'm also a pastor of a Baptist church here, so I'm here with my family long term. I'm not an internal medicine physician, so I've practiced rehab medicine in the U.S. So, although we have some rehab patients who need rehabilitation care here, I've been learning a lot about areas in medicine that are not my area of expertise, so I think that's probably been the most challenging thing.
So, Elizabeth, introduce yourself. Where are you from? Why are you here?
Well, I was born in Cuba, but when I was 13, I moved to the United States, and I lived there with my family in Miami, Florida. I go to Dartmouth College, it's a school in Hanover, New Hampshire, and I'm pre-med, so I'm here more to learn about the healthcare system here in East Timor. I just hope to be able, when I do become a doctor, to come back and get back to the people here in East Timor.
What's got you most excited?
The what?
What's got you most excited about coming back?
Just being able to know what actually is going on with these patients and understand more the medical side of things, and actually have more useful input to help out.
But you could graduate and just take up life in the U.S. What entrances you about Timor? What do you see in Timor?
Well, I see a young nation that has a lot of potential, and I see a lot of dedicated youth here, so it's not something you find every day.
Your name is?
My name is Belazar Guzman. Sí.
What are you working on here, Belazar?
I'm help the patient to do medical certification for them.
What does that mean?
Yeah, like if they are sick here, and then they need some letter for their school.
Okay. This is Samoa. Tell us about your story, Samoa.
Yes, I'm a nurse for a long time here with AVI, Australian Volunteers International. So sending me here just for 2 years already, so I can help out this clinic. I'm an Australian, but I was born here and grew up here and studied here for my nursing.
Invasion?
Yes, Indonesian invasion. I came after because the reason why I went to Australia because it's close to Timor. In 1997, yes, as soon as I got my citizenship, straight away applied for my passport and then came to Timor to rescue people here that's really in need.
Tell us about yourself, Max.
My name is Max Xu. I'm a student at Brandis University right now. I'm going to go into my senior year this coming fall. I'm just here for two reasons. One, I'm part of a nonprofit called Project Plus One. We're a nonprofit that's working with the Bairo Pite Clinic and the people of East Timor trying to provide sustainable health care. One of the big things we're doing this year is we have a grant from the President School for Boys in Boston, which is to build a farm at the East Mac T-Bar Clinic. Right now we're still doing the research stuff for that, but the biggest thing we're doing now is we fix the water pump there, and we're trying to do some surveying with patients to figure out what exactly to do in terms of planting things. But my passion actually is for public health, so hopefully after I graduate I'll be able to get into public health for a master's, and then maybe come back to this country for a longer term.
Docs, what's the situation?
There is a philanthropist, Shane.
I'm Shane Granger, the captain of the historic vessel Vega, a 120-year-old historical monument that now dedicates her time, her energy, and the energy of her crew to providing humanitarian assistance to small isolated island communities in Southeast Asia. One of the places that we help is the Bairo Pite Clinic in East Timor. Bairo Pite, famous for Dr. Dan Murphy, is a free clinic in Dili that provides medical services to those that cannot in any way afford other help. Dan's clinic is supported by people like us and our friends who take lists that he gives us every year. We go out, we try our best, we gather together as much as we can, the best that we can, and then we deliver it on our routes coming out into the islands. One person might provide 200 thermometers. Another person might provide stethoscopes, blood pressure cuffs, oxytocin, ampicillin, antibiotics, other things that are needed. One place where we really try to concentrate are expendables. These are the things everyone else seems to forget. The materials that are used and discarded, and if they're not replaced, doctors like Dan and Ida cannot continue to do their jobs properly. One of the ways that we help are midwife kits. These kits are comprehensive packages containing everything that a rural midwife needs to do her job. Another, health worker kits, designed to provide a community of between 500 and 1,000 people for roughly 1 year. We're pretty proud of that. But it's not that we're a big organization or that we're supported by big companies who pour massive amounts of money into what we do. It's all individual efforts, things that are provided by individual people. One person might provide 200 thermometers. Another person might provide stethoscopes, blood pressure cuffs, oxytocin.
This is our laboratory, small laboratory.
Clinic staff and the ministry staff.
Bella interview.
Bella.
Naran Saida.
Nusrat Emmanuel.
What do you do in Bairo Pite Clinic?
I'm working at Bairo Pite Clinic since from January 2011, and I'm volunteering there, and I'm working in emergency and inpatients.
You're now in Bairo Pite Clinic working. How could you adjust in a place where there's a lot of things, nothing compared with your country?
Actually, if I compare to Pakistan, Pakistan is better than Timor-Leste. But in Pakistan, we have many crises like bomb blasting in the schools, in the markets. So we came here, Timor-Leste, and we find a very peaceful life here.
We are now about to cross the Bilimau River. The water's not too deep, and so we're managing to just drive through it. We haven't been able to get out yet, so we're trying to dig out the sand from underneath the tyres and put rocks under there. Rescue's on the way now with a bit of rope. Doesn't look very strong. Trying again. We've built a longer pathway with the rocks. Let's see what happens. Got everybody pushing. And the road's great. Everybody's helping push again. Those pectorals are spinning. And people are getting ready to push. The guys are cool, but the road's great. Those drivers going to pull into help. Probably doesn't think the road's strong enough.
Alhamdulillah. Yes, I'm happy. Very happy.
Goodness, having a ride. Highlight of this day. Just drives across with no problem. Well, the way people usually drive here, usually travel here.